Now we need to go to community by community, neighborhood by neighborhood, and oftentimes door to door, literally knocking on doors to get help to the remaining people protected from the virus.
Dr. Nicole Saphier joins us now. She's a Fox News contributor and author of the book Panic Attack. When I heard that, I thought, okay, well, he's trying to give it a shot to get people more information. Why the backlash? Do you agree with it?
So, well, Dana, I mean, the president found himself in a bit of a dichotomy during that speech. At one hand, he was declaring an independence from this virus, and he's right, because Americans have the opportunity to choose to be vaccinated to protect themselves and their loved ones from this pandemic. But declaring that independence doesn't mean the pandemic is over. But now all of a sudden he says, and by the way, we're going to send grassroots, low-level government workers to your house. And while some people may see this as a public education push, which is always a good thing, the more education, the better, other people may see this as confrontational. And I can tell you, Dana, that's not how you're going to reach that vaccine hesitant population by sending people to their house. They're going to already feel that you're invading their space.
Yeah, Dr. Nicole, listen to this from Dan Crenshaw, congressman from down in Houston. He says, how about don't knock on my door? You're not my parents. You're the government. Make the vaccine available and let people be free to choose. Why is that concept so hard for the left? So I think that's one of the things you were saying. I also noted today that in the Washington Post, it said in Maryland, 100 people died of COVID in June in Maryland, and 100% of them were unvaccinated. And that was one of the things that the president was trying to say yesterday, I suppose.
Well, and that's not just Maryland. That's many states across the country, and other countries are seeing that as well. Yes, the deaths that are still occurring from SARS-CoV-2 tend to be those that are unvaccinated. So the best way to protect people is to get vaccinated. But again, this is a freedom of choice, and that is what is very important. It goes to the core of our country. When you turn on other media outlets, you actually hear people calling for requiring them and mandates. And if you can't declare independence and the freedom to choose vaccination and then require them as well and say we're going to be sending government officials, these are conversations that need to be had between physicians and patients and not by low-level grassroots people knocking on doors.
The other thing I've really noticed in the past few days, and it's been building, but a lot of the headlines are all targeted and sort of blaming anyone who voted for Trump or the red states, and they're the ones that was the problem. Now, a lot of those places are rural. Some of them don't have the fancy freezers that could take the Pfizer and Moderna vaccines. The Johnson & Johnson might be more available. But how would you persuade someone at this point to get the vaccine? What do you think is the best approach?
Well, listen, Dana, there was a lot of politicization throughout the entire course of the vaccines, but the best thing that the current CDC and the administration could do right now is to reach out to those vaccine hesitants. And that has to do with getting full FDA approval of these vaccines. I think you will really help people trust the safety more if you get that full approval. They have the data to do that. They need to be transparent. They can't be so myopic when it comes to the adolescent recommendations, especially as we see a rise in cases of the myocarditis. They are continue to neglect natural immunity, and they continue to recommend full dose for these adolescents, regardless of risk and regardless of presence of natural immunity. If they actually did that, I think that they would gain the trust of the American people more. This has nothing to do with Trump. When it comes to the rural populations, yes, you have to make sure that it's available to them.
Right.
And you have to make sure that they have the education. And the way to do that is to reach out to the local public health officials and the trusted physicians in the area, not send government to their homes.
All right, Dr. Nicole Saphier, great to have you this morning. Thank you.